Right, so Health Minister Dr. Zweli Mkhize has assessed the Western Cape state of readiness for the second phase of the vaccine rollout. So far, over 53,000 healthcare workers have been vaccinated in that province. Our eNCA reporter Ayesha Ismail has been on that story for us. So Ayesha, obviously the bigger question this evening is what the Health Minister's had to say about this temporary precautionary halt in the rollout of the Johnson & Johnson vaccines, which he called last week, obviously in response to the USA move by the Food and Drug Administration there, that due to concerns that there may be a link with a very rare blood clotting disorder, they were halting things. What's the latest from the Minister?
Well, at the press briefing, the Minister did talk about this and did also mention that SAHPRA has now given the go-ahead for the Johnson & Johnson Sisonke trial to proceed. And he said while they've got this go-ahead from SAHPRA, the health officials, health department and government is still having ongoing talks with ethics committees, the Medical Research Council, the WHO, as well as Johnson & Johnson. And as you said in your intro, and this was a precautionary measure that they took to pause the Johnson & Johnson trial.
All right, so SAHPRA, which is the Health Products Regulatory Authority, is saying, OK, we can carry on, but more consultations are required, as you say, with the Medical Research Council, WHO, and obviously Johnson & Johnson. Did he give you any indication of how long that will take before actually we're going to see more healthcare workers becoming vaccinated?
Well, Sally, the way he put it was that they're being very cautious. They would rather, err on the side of caution. So basically what he said was that we will be receiving more vaccines. And you will recall that last week he addressed Parliament and he calls it a misunderstanding with Johnson & Johnson. Well, now he says that that misunderstanding has now been cleared up. All the T's, they've crossed their T's and dotted their I's. And we can now expect 31 million doses from Johnson & Johnson and also 30 million doses from Pfizer.
All right, so those 31 million doses, obviously, those are going to come through from the Aspen plant in Gqeberha. What was the misunderstanding? I should just explain that to us.
Well, what he said was that, negotiations are very complicated. And he says it's not just an easy transaction. There needs to be guarantees in place. And he also pointed out that what they did was, when they started this procurement of vaccines, they also, along the way, they've learned a lot of lessons. But again, as he said, there was a misunderstanding. That misunderstanding has now been cleared and the contract has been signed. And we can expect those manufactured Johnson & Johnson doses to arrive by the end of the week. Now, obviously, we're not going to be getting, the 31 million in one batch. They will be coming in quarterly batches, starting from the end of this week, right up until October.
All right, so the first batch, I think it was set down for April the 22nd for the first lot of Johnson & Johnson vaccines to roll out of the factory in Gqeberha. Is that where they're going to be coming from?
I would imagine that would be so because he talked about the manufactured Johnson & Johnson doses. So I imagine that it would be the ones coming from Gqeberha.
All right. Well, thank you so much, Ayesha Ismail. That is really important news that we are still on track to receive those vaccines, those Johnson & Johnson vaccines, which are going to be filled and finished here in South Africa, that the contract is definitely all sorted out, and that SAHPRA is now giving the go-ahead for that Johnson & Johnson vaccination process of health workers to continue, but it still has a couple more hoops that it has to jump through. We're going to be trying to get some comment on what still needs to happen before those vaccinations can continue.